Thanks for stopping by my channel and checking out this video. My name is Kelly, I'm 26 years old, and I suffer with stage 3 endometriosis. March is Endometriosis Awareness Month, and I figured it would be the perfect time to start my channel and share my journey with everyone. We really need to bring awareness to this debilitating disease. Today's topic is, what even is endometriosis? Endometriosis is a condition where tissue that is similar to the lining of the uterus grows in inappropriate places throughout a woman's body. These places can include the uterus, the fallopian tubes, the ovaries. It can even include the diaphragm, heart, lungs, and eyes. It's also been found on the liver and throughout women's bowels. It feeds on estrogen, so when you're a young, healthy woman with healthy ovaries, healthy bones, etc., basically all the healthy things that form and give off estrogen, endometriosis grows quicker. And because it's an autoimmune disease, if your immune system is weakened for some reason, that also gives the endometriosis an opportunity to grow further. Endometriosis presents as tissue, lesions, and adhesions. The tissue dissolves monthly with the menstrual cycle. Since it's outside of the uterus, there's nowhere for it to go, and your body can't clear it. The dissolved tissue can then turn into adhesions, and it causes a lot of inflammation. Adhesions can glue organs together, causing pain, infertility, problems with going to the washroom, and more. Endometriosis also presents as lesions. Lesions are very painful. Lesions become self-sustaining, similar to cancer. They can form their own blood supply and produce estrogen to sustain the disease. So you could basically take out all other sources of estrogen in the body, but the lesions can still keep going, still keep growing, and continue the disease. Another question I get is endometriosis cancer? No, but they do share similarities. And endometriosis is often more painful than some forms of cancer. Like cancer, endometriosis causes cell death, but the difference is in the methodology. Cancer penetrates and invades cells to kill it. Endo surrounds cells and smothers them. Endo can't be classified as cancer as the methodology is too different. Another way endo is similar to cancer is in how it spreads. Endo can spread throughout the body using the lymphatic system, just like cancer cells. Also, some cancer tumors can be self-sustaining and emit hormones, just like endo lesions. Studies show that having endometriosis can raise your risk of ovarian cancer, and currently there's no really good preventative screening tool for ovarian cancer, so you have to be really in tune with your body and look out for any symptoms. Your pap smear likely won't pick it up. In women with endometriosis, elevated levels of both TGF-beta1 and lactate are found in the peritoneal fluid. Increased lactate promotes characteristics also seen in cancer, helping cells invade surrounding tissue, stimulating new blood vessel formation, and weakening immune system response. Very important. All of which help endometriosis lesions establish and survive. Scientists have found that diachloroacetate, DCA, a drug targeting the metabolic alteration used in some cancer treatments, reversed the abnormal metabolism when administered orally to mice with endometriosis. And yes, they successfully induced endometriosis in mice and then cured it with DCA. DCA reduced lesion size, suggesting that targeting this cancer-like metabolic change could effectively treat endometriosis, and they have moved on to human trials with this. Really, really cool. Another question that's commonly asked is, how is endometriosis treated? The gold standard for treatment of endo is excision surgery. Unfortunately, a lot of doctors are not trained in excision surgery, specifically for endometriosis, and they were trained in ablation, which is basically burning the surface of like a lesion or endometriosis tissue. It just burns the surface. It doesn't take the disease out at the root like excision surgery. There's a really high recurrence reoccurrence rate with ablation, and reoccurrence rate with excision surgery is much, much lower, with some women finding total relief and only having to have 1 or 2 surgeries in their lifetime. Hormonal treatment is another way to treat endometriosis. Surgery and hormone treatments are often combined. Medications such as Dynagest, Myfembree, the Mirena coil, and other progesterone-based medications can be effective to suppress endometriosis and lower symptoms. The best medications are ones that don't have a lot of estrogen, since endometriosis does feed on estrogen. Another way to help endometriosis symptoms is to help your body with the autoimmune and inflammatory components of the disease. This can include an anti-inflammatory diet, natural anti-inflammatory such as turmeric, ginger, or my personal favorite, which is black cumin seed oil. It can be helpful for a lot of people, and personally, it's helped me a lot. For the immune system, supporting your body with regular sleep, sunlight, lowering stress, and even some immune system modulating medications such as low-dose naltrexone can be helpful for some people. Endometriosis seems to worsen when the immune system is compromised. It's taking advantage of your compromised immune system to further itself, basically. Another question that people ask is, how many stages are there to endometriosis? And is it staged like cancer? There's 4 stages to endometriosis. It's not staged exactly like cancer. The stages of endometriosis are ranked in severity of the disease progression, along with a combination of where the disease is located and how it shows up. And it also doesn't correlate to the level of pain that you're experiencing. Some women have stage 1 endometriosis, and they're basically crippled by how severe the pain is. Other people have stage 3 and barely have any symptoms. I know somebody who was stage 3 and had no symptoms. The differences in the stages are as follows. Stage 1 is minimal, few superficial implants or lesions with minimal to no scar tissue. Stage 2 is considered mild. It's a greater number or deeper implants along with thin, filmy adhesions forming. Stage 3 is moderate endometriosis, deep, widespread implants, small endometrioma cysts on 1 or both ovaries, and thick, dense adhesions. Unfortunately, that's the stage I'm at. Stage 4 is severe, widespread, deep implants, large endometriomas, aka chocolate cysts on the ovaries, and dense, extensive adhesions. The space behind the uterus is often obliterated, basically. So what are the common symptoms of endometriosis? I'll just read them out, and I'll also put them on the screen. They include severe period pain, chronic pelvic pain, period pain that begins before you bleed and lasts until after your period, fatigue, unexplained infertility, pain in the lower back, bloating, painful sex, pain with bowel movements during menstruation, constipation and diarrhea, often alternating, pain that radiates to the legs, lightning butt. If you've ever been pregnant, you probably know what I'm talking about. Sciatic nerve pain, nausea or vomiting from pain on your period, pelvic pain with ovulation or period cramps during ovulation, or even light spotting during ovulation, pain with urinating, pelvic floor spasms. That's just the common symptoms of endometriosis. Now here comes the rare ones. Chest pain, shoulder pain, usually the right shoulder with your period, coughing during your period, collapsed lung, coughing up blood, pain and swelling in the ribs and diaphragm, increased allergies or sensitivities due to suppressed immune system, or having a bleeding belly button during your period. That's actually a super rare form of endometriosis. By the way, it's really fascinating. The line that connects to your belly button sometimes doesn't fully close, and then the endometriosis tissue gets on it. It's really fascinating. I'll have to do a separate video on it, but while it is fascinating, it's also a little bit horrific. But yeah. If you know of someone who has horrific periods, reach out to them, talk to them about endometriosis, see if any of these symptoms resonate with them, because earlier intervention is key to prevent basically what's happened to me, where I'm essentially housebound with severe endometriosis pain. I can't walk more than a block. I mean, last time my husband and I took a walk down the block, I had to go to the ER for morphine. And, that's just basically my lot in life right now. I'm looking forward to hopefully getting excision surgery in about 9 months. I'm currently doing hormonal treatments for endometriosis, but if I had done more in my teenage years to advocate for myself in the healthcare system and seek out medical care for my severe period pain, I might not be in the position I'm in today. And if I can help even one person prevent something like this happening to them, and it'll be worth it. Thank you for watching, and I hope you have a wonderful day. Please like and subscribe, and yeah, I'll catch you in the next one.